Good evening. I'm Arian Powell.
And I'm Aria Burton. Welcome to this 2024 special edition of Broadcast Bootcamp News, focusing on health disparities in Mississippi. This show is made possible thanks to a unique partnership between the University of Southern Mississippi School of Media and Communication, the Mississippi Association of Broadcasters, and the Mississippi Scholastic Press Association.
This year's Broadcast Bootcamp also would not be possible without financial backing from the Dow Jones News Fund, so we thank them for their monetary support.
For our next two newscasts, we explore the critical health disparities affecting Mississippians. We'll examine the issues through the lens of race and ethnicity, gender, education, household income, and rural versus urban statuses. And we'll also look at the efforts of the state to address these pressing issues.
As part of our look into how health disparities are impacting Mississippians living in rural areas, our Broadcast Bootcamp reporters visited Dr. Vicki Reed, Associate Director of Public Health Program here at USM. Aria Burton has the story.
Healthcare disparities are a leading cause of the health crisis in Mississippi. One issue within these disparities is the availability of healthcare in rural areas. Healthcare professor Vicki Reed at the University of Southern Mississippi shares more on the topic.
South Mississippi, with Forest General being here, with being a high-level trauma center, so the people in the primary, the primary vicinity, that they have, pretty decent access to health care. But the further that we get in more rural areas, and depending on what part of Mississippi that we're talking about, that availability decreases drastically.
Geographic location plays an important role in the quality of health care. It is important to know what access you have and how to get the help that you need. Rural areas have a higher prevalence of health disparities due to the location. Dr. Vicki Reed has more on the issue.
Like OBGYN services, everybody, regardless of probably where you live, someone is probably gonna, be pregnant and they need to deliver safely for both mom and baby, but there are many areas in Mississippi where that service is not readily available, and a mom might have to travel at least an hour to get that service. So,
Eric Bryan reporting here from USM Broadcast Bootcamp.
Addressing these health disparities require urgent, comprehensive action to ensure equitable health care. For more information about the Harriet House and their efforts to combat health disparities, visit theharriethouse.org.
Mississippi has major problems when it comes to access to health care. Jaden Koss has the story.
Healthcare providers are always searching for ways to improve the system. One of their top priorities is to gain access.
Mississippi's health inequality is a huge issue plaguing the state. We've spoken with USM's Dr. McLeese for more information on the matter.
Mississippi is ranked 51st. I was like, wait, what? We're 51st? There are 50 states, so we're lower than one of the territories.
Some say they are trying to form a solution.
I think actually we may be at this point the only industrialized or Western country without nationalized health care. And what's wrong with experimenting? Why not try, for a few years?
Martin believes that the leaders of Mississippi look down on minorities and those who are poor.
During the summers, there are basically available for kids free meals at most every public education center. They don't cost the state anything. It's federal grant money. And Mississippi is just going to turn it down just because we don't want people to eat. I don't know why. It's like they really have a propensity to punish people for their economic position, and that's wrong, in my opinion.
In conclusion, healthcare injustice is a huge problem in the state of Mississippi. The decrease in essential and effective treatment to patients is not permanent and is a fixable matter.
This has been Jaden Koss with USM's Broadcasting Bootcamp.
If you are in need of help with medical insurance coverage, you can visit healthcare.gov.
Last segment, we take a look at the state's response to the health crisis. Stay with us through the break.
Welcome to the USM Speaking Center. We are so proud of the resources that we offer to the campus and community. The USM Speaking Center is nationally recognized for its work in training undergraduate and graduate peer consultant.
We offer one-to-one appointments for students who are working on a presentation for any class in any major. We can help with brainstorming topics, researching, using sources, outlining, and organizing. We can also help with timing, visual aids, and developing your own unique speaking style. In addition to individual appointments, we work with small groups and offer workshop programming for classes and other campus groups, helping you to make better connections with your various audiences and speaking situations that you may encounter.
To set up an appointment, go to usm.mywconline.com and choose the Speaking Center from the drop-down menu. Enter your student ID and password in the provided box and search the scheduler. Click on the day and time you would like to make an appointment. Please be sure to verify if you would prefer an in-person appointment or an online appointment.
And don't be afraid to stop by Cook Library 117 on the Hattiesburg campus or call us at 601-266-4965 during our office hours Sunday through Friday if you have questions. We look forward to meeting you.
While many Mississippians wonder what can be done to combat this health disparities, our reporters turn to Dr. Christy Barnett, Regional Health Officer for the Southern Region, to see what public health officials have planned to do to help these growing concerns. Ava Walker, James McDaniel, and Jasmine Jeffries have the story.
The healthcare crisis in Mississippi is an ongoing issue. To face these issues, it is important for the state and community alike to come together to solve these disparities. Dr. Christy Barnett, the Regional Health Officer for Mississippi Department of Health, has more on these issues.
Yeah, you see a lot more probably, and it's not really necessarily a choice. You know, a lot of people in lower income areas or that are lower income may not have the funding. They might not have the, you know, a car to come to places. And so that's kind of part of the social determinants of health issues is economic disadvantages.
For several years, Mississippi has ranked last or nearly last when it comes to health in the United States. Dr. Christy Barnett believes that everyone should be treated equally regardless of race or their background. She has more on this subject.
Employing community health workers and trying to get those in all areas, all health departments. And basically, when we see a patient in the clinic, you know, we go through the social determinants of health to see if there's issues that they may be experiencing. And so, you know, of course, the staff in the clinic is limited to what they can do, but the community health workers can follow those things up, whether it's internet access, job issues, getting insurance coverage, Medicaid coverage, things like that, whatever, you know, food insecurity, housing insecurity, so they can address those topics and try to get us off the bottom.
This is Ava Walker reporting from the USM Broadcasting Bootcamp.
Are in search of health care, visit your local clinic for support and resources.
This has been a production of the USM Broadcast Bootcamp. Thank you to the Mississippi Association of Broadcasters, the Mississippi Scholastic Press Association, the School of Media and Communication, and a special thanks to you, Dow Jones News Fund, for their financial support. If you would like to participate next year, contact Dr. Ed Simpson at edgar.simpson@usm.edu. Thank you again.